I'm Dr. DeLay. I'm a board-certified urologist in South Carolina, and today I'm going to talk about hematuria. So hematuria is defined as blood in the urine. There are two types of hematuria, microscopic hematuria and gross hematuria. Microscopic hematuria means that it was a laboratory finding only. This usually happens when a primary care physician checks a urine sample as part of routine testing. When they do this, a sample might reveal blood in the urine, and you could be referred to a urologist for further evaluation. The second type of hematuria is called gross hematuria. And gross means that it was actually visible to the eye. So here, you would be the one to find the symptom and report it to your doctor. You would notice either pink or red urine and possibly even the passage of clots. And this is important as a symptom and something you would definitely want to report to your physician. There are a number of causes of hematuria, but these can include infection, stone, bleeding disorders, urologic tumors, enlargement of the prostate, and medical problems with the kidney, and some other less common conditions. If you were referred for microscopic hematuria, the first thing we do is make sure you actually have hematuria. And what I mean by this is that we will do an examination of your urine under a microscope to make sure you actually have red blood cells. The reason this is important is most urine samples have a dipstick analysis, meaning they put a test strip into the urine and look to see if one of the indicators changes colors. This can happen with what's called a false positive, meaning the color changes even though there aren't red blood cells. So we do a microscopic examination to make sure there are red blood cells. And if in fact you don't have any red blood cells, then no further evaluation is necessary. Assuming that you do have red blood cells or that you had gross hematuria, we need to do an evaluation. What we're trying to do is examine the entire urinary system to make sure there are no abnormalities. This usually involves some type of imaging of the kidneys, usually a CT scan, but sometimes an ultrasound. The bladder can't really be visualized very well with imaging, so looking from the outside usually isn't sufficient. Because of this, we need to do a test called a cystoscopy, where we run a small flexible telescope into the bladder and look around. This is done in the urologist office under local anesthesia and usually lasts a minute or less. If you actually saw blood, the urologist will also do what's called a urine cytology, where a pathologist looks at your urine under the microscope to confirm that there are no cancer cells. Thankfully, we often don't find a cause for hematuria. As long as the urologist doesn't find anything bad on the above testing, we usually just follow up by doing an examination once a year for several years.